Hello everybody, I hope you had a good week off. Spring break was a few nice days, but a few chilly days too. We had some snow here and everything, but anyhow, it's March, what can you do? So we're a bunch of stuff going on this week. This is my last lecture of substance. And so I hope this helps, but let's go over some announcements first. So we had the spring break we're just coming off of. You've got your health ecology project, which is due on the 22nd. That's this Friday. And next week on the 26th, I'll post the final exam, and I'll do a video where I discuss every single one of the questions in the final exam. Remember, the format's going to be an essay with choice. So I'll give you, 6, 8 different kinds of different questions, and you have to choose 2 of those and respond to those 2 completely separate questions with 2 completely separate essays, okay? So, essay is kind of a loose thing because I may give you some data to analyze. I may, come up with something interesting. Give it a try. I try and make my exams interesting, and most of all, I try and make them into learning experiences rather than punishment for doing whatever it is you're doing. So anyhow, so look for that next week, and that'll be due on the 30th, which I believe is Saturday. Now, on the 28th of next week, also your final project summary is due, and we'll talk about that in just a second. I'll give you feedback by the 2nd in my courses, so I'll respond to your post in my courses, and then if you'd like to talk to me, I'll be available via Zoom during my office hours on the 2nd and the 4th, and other times also if you're not available during that time or whatever. I try and make myself available. Then you'll get some time to work on your final projects, and of course, after you complete your final exam. And then you'll have your final project presentation recording due on the 19th. Now, your recording, you can post it lots of different places. As you know, I like YouTube, and that seems to work pretty well for me. If you want to use something else, so that's all right. What I'm going to expect from you is a URL in my courses, and I'll make those URLs available for everybody in the class to take a look at also, just so that your colleagues can see the interesting work that you've done. So kind of cool. And then you have a final project report, which is kind of a written version of your presentation that's due on the 30th. And remember, the reason why I'm having you do that final written report is because you guys have a capstone project to work on, and you need some more practice writing. How do I know that? Because everybody needs more practice writing. So that's what we'll do with that. So your final project proposal, right? Well, let's talk about final project. Project groups can be up to 4 people and can be the same group you've worked with all semester. However, you can choose to form a different group if you would like. And that's all good. Azure DevOps project summaries in the form proposal are due on the 28th. We're going to use Azure DevOps. I think using Azure DevOps as a constructive tool to help you do group project work is one of the primary outcomes that you get from this class. So I really want to put a lot of emphasis on that because I see it as really important. And then I'll give you feedback, blah, blah, blah. Now your final project presentation, I'm not going to post videos, formal videos on those days because you'll be working your final project. And you've got your recording. Okay, let's see, we did that. We did those. Project ideas. So here's the one requirement I have for your final project. I want it to be in the format of telling a story with data. Now that means it's going to be a combination of text and graphics organized to have a beginning, middle, and an end, you're telling a story, and you're illustrating different important parts of the data side of your story by using these graphic elements. You can do it in BigQuery and Data Looker, no problem whatsoever. Very possible to do it there. Or if you want to use Tableau or some other tool, you can do it there also. Don't try and do it in Excel though. I know you can do some graphs and stuff in Excel, but it's not the same. So, my guess would be either Tableau or Data Looker, but it's up to you. Your final project should be related to your final capstone, just because you should be working on different sides of your final capstone. The final project should be interesting to your team. Find something that's neat, that's cool, that's interesting. And I'm open to discussion about topics. So if you want to send me an email, you want to, post something, you want to Zoom with me or whatever before the project proposal is due, I'm happy to do it. Not a problem whatsoever. Just let me know. And that's how we'll do our final project. Your project summary should be, you can use this format. This is a useful format for an academic capstone, as well as it kind of fits into Azure DevOps. Mostly the project summary has the introduction and kind of the lit review in it, and then the methodology and the deliverables and the project plan. That's all done within Azure DevOps in your project backlog, your sprint scheduling, your all of those different sites that you can use Azure DevOps for. That's kind of where this methodology, series of steps, fits into the project backlog. Deliverables are, forgotten the phrase, the outcome that's associated with it. It'll come to me. And that's the deliverables. And the project plan is, kind of how long is this going to take? So that's why I think Azure DevOps will work really well for it. So when I say the project summary is due on one date, yeah, you can do it like that. You can just have these parts in your project summary if you'd like. But at some point, you're going to have to do these parts also. So if you wanted to have all of this done and organized by the time you turn your project summary in, well, that's probably a great idea, and hopefully it will help your team as you interact and you decide who's going to work on what issues from the project backlog. That's all good and needs to be done at some point. Why not get it done earlier rather than later? Your project presentation should be about 20 minutes. That's about it. Once you've worked on this for a while, you're going to have way more than 20 minutes worth of stuff to say. But let's try and keep it right around 20 minutes. So, not because your project isn't interesting, but because being brief, brevity is a virtue, and getting used to working on deadlines and timelines, that's a virtue also. So here's a couple of things that you can include in there, and just as general good ways to structure a presentation. If you've seen people who are really good at presentations, you'll know what I mean. Doing it well is challenging and very, very, very useful. So get used to work on your project presentation. Think about how you can do this the best way possible. Put some time into it, and then try and stick at 20 minutes. Most of the time when you do a presentation, you've got a time limit, and if you go past that, that's really bad. So, stick to that 20 minutes. Your final exam, I think that we talked about this already, and so there's that. Project ideas, well, you could, easily do something based on the total solar eclipse that's coming on April 8th. How interesting and timely is that? They're talking about tons of people coming here to Rochester and Buffalo because we're in the path of totality. Well, there's lots of different sides of this event that you could talk about and tell your data story around. Very interesting stuff right there. On the other hand, you might want to look at some of your past projects. For instance, the health and ecology one. I've heard some really interesting project ideas that people have come up with. And yet, for the just the class project thing, you're kind of limited to how much time and how much work you can do on this. Expand it. Take what you did from the health ecology project and make it better. Make it interesting. Turn it into a data story. Make it really cool. Bring in other sources of data. Make it interesting. So, lots of different ideas. You could do the same thing with the other projects that we worked on also. You could think about Chicago real estate and do a presentation, expand your project that you did there. Or you could take that same discussion to other places. There's an Austin, Texas crime set. There's, lots of different sets of data out there that you can use that would make for an interesting project. So make it interesting, make it useful, make it cool, okay? So today we're going to talk about health and health informatics and health analytics. And of course, the side of this is that unlike other kinds of forms of informatics, in the health side of data, there's a real origin story here. And a field of expertise that you can go get a PhD in, and that's epidemiology. Epidemiology has its origin story in 1854 in London, and it's interesting. So there was a cholera outbreak. Nobody knew why there was a cholera outbreak. Nobody knew who was getting sick. Nobody knew why they were getting sick. But this Dr. John Snow painstakingly traced the source of the cholera infection back to one well. And all the people who got sick with cholera in London had been drinking water out of this one contaminated well. That's interesting and pretty cool stuff. So epidemiology defined, well, it's the study of distribution and determinants of health-related states among specified populations and the application of that study to the control of health problems. Well, we all just lived through a pandemic, and that was, kind of a case study in motion of epidemiology. We all heard those scary reports from the Centers for Disease Control and Prevention. We all saw that they made recommendations about what we should do and what we shouldn't do. Some places followed those recommendations, some places didn't. I don't know your politics, but it was interesting to see it in action. Now we're seeing it again with the measles outbreak in Florida, and the governor's Surgeon General has decided to go against CDC protocols, and we'll see what happens with that. That's epidemiology. How do diseases spread? What can we do about them? Well, this is a big and important topic. When you think about some of the big events that have happened, there are things like the Ebola outbreaks, the HIV outbreaks. There's all of these diseases that happen, just among people. Well, this is a public health issue, and we need to think about how do we organize for this? How do we prevent this? How do we do this? That's epidemiology. So it's got 4 different parts to it. So surveillance, which is what's the problem? When somebody gets sick, most of the time they just get better. But sometimes it's a special sickness. And how does that come to light? How does the Center for Disease Control know about flu outbreaks in across the different states? That's a surveillance issue, and we're looking for the problem, and we're looking to recognize some problems as more important than other problems. Then risk factor identification. What's the cause? How did Dr. Snow determine that it was people drinking from a well? That's a really complicated thing to do. Intervention evaluation. What can we do to prevent this? And then finally, implementation. How do you do it? How do you respond to these disease outbreaks? So, there's really interesting careers in epidemiology, and there's government jobs, and there's private sector jobs, and there's lots of work that can be done with epidemiology. But public health issues are complicated. And it's hard for people to get used to, what kind of things people have to do. What's the trade-off between people's privacy and ability to do what they like compared to the need for us as citizens to try and protect each other in the case of a disease outbreak. Well, there's some core sciences that go with public health, and that's things like epidemiology, laboratory work, informatics, surveillance, and then prevention effectiveness. Here's some different groups that work together to provide our public health services to make it so that we can all live longer lives. The purposes in public health practice are things like discover the agent, discover the host. What are the environmental factors that affect health? Determine the relative importance of causes of illness, disability, and death. Identify those segments of the population that have the greatest risk from specific causes of ill health, and evaluate the effectiveness of health programs and services in improving public health. Now, we can look at all of this from the perspective of the COVID epidemic and get a grasp of, what was the CDC trying to do? Why did we hear the things that we did? And where did their efforts to manage the COVID outbreak, where did they kind of fall apart, and where did they work well? So when we think about solving health problems, there's a number of different steps involved. The first step is this idea of data collection, and that's our surveillance thing. How do we know when one particular public health outbreak is really serious and we should do something about it, and when do we let it ride and people will just get better? Step 2 is assessment, where we look at how badly the system is, what's the infectiousness of the particular disease. And as we look at the measles outbreak, that's one of the things about measles. It's incredibly infectious. Most people do fine with it, but some people die. Some people have, their brains swell. I've forgotten the name for that one. But anyhow, assessment. And then hypothesis testing. How and why did some people get this disease and others did not? That's not a trivial thing to keep track of. It's really a hard thing to keep track of. And then what kind of interventions really make the most sense in light of the disease that we've got, its infectiousness, the way that it spreads, and where it currently is, the stage of its growth throughout the population. Well, this is a classic statistical problem, where we're talking about rates versus samples, or populations versus samples. And rates are a way for us to think about, can we really generalize from a sample of of people to the overall population. And that was one of the problems that we had throughout the COVID epidemic. We had different places where we had different samples, and it was hard to generalize from the samples that we had to the overall population. And it was interesting to see people try and do that. So we're going to run through just a couple of quick case studies. This first one is from 1976. So, but it was really interesting because it's a real health outbreak. So, the American Legion had a convention in Philadelphia in 1976 from July 21st to July 24th. But on July 26th, after people went home, there was 18 deaths reported among conventioneers. Well, here's the first question. These people had gone home. How did people correlate the fact that a legionnaire died at home in Chicago back to the convention that they went to in Philadelphia? They were probably treated by their physicians in Chicago, and the physician saw a disease of a respiratory nature, and the person died, and that's it. But how did that physician in Chicago report back to and other locations? How did they report back to the Center for Disease Control to say, hey, wait, this was kind of suspicious, and this person just came back from a convention in Philadelphia? Did the physician even know? It would be really easy for somebody to go home to wherever they're from and die and not put two and two together, that there was a connection between the convention they went to and the disease that ended up killing them. So healthcare provider Veterans Hospital in Philadelphia calls the CDC to report cases of severe respiratory illness among attendees of the American Legion Convention. So in Philadelphia, they have a Veterans Affairs Hospital. Well, that turns out to be a really important part of this story, because the VA, the Veterans Administration, part of our contract with our returning servicemen and women is that they'll have access to health care for the rest of their lives. And they do that through the Veterans Administration. And the Veterans Administration has been in existence for, I think, since the Civil War, but probably before that. And they run these big hospitals. So maybe they had enough of these, the American Legion is past service members. So maybe they were the ones who said, this is not just one person dying or getting severe respiratory illness, it's a bunch of people. And so they might have had enough cases to make it so that they paid attention and report that back to the CDC. And then on August 2nd in the evening, they probably sent out a message somehow or another. There were 71 additional cases reported of this severe respiratory illness. So we can look at it. So, how do you come up with the hypothesis of how this was spread? What was it about that convention that made it so that these people ended up dying? Now, if you've been to a convention, you'll know that there's usually a central hall where everybody comes and they, go have tables and presentations and talks and blah, 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 blah. And then you go out to stay in your hotel, wherever that may be. And, this was a fairly large convention. So it turned out that there's a lot of different age groups there. And it turned out that people stayed in lots of different hotels. And so how did we get to this point? So you have to think about the initial analysis by just saying, well, what's our frequency? Let's look at look at it by age. Why age? Well, it's health data. You know, older people tend to have more issues with their health than younger people. So that's interesting. And let's see, so then we look at this, and we've got ages 50 to 59. There was 320 people, and they had an 8.4% infection rate. But look at these older people, we're at 20%, and 60 to 69, 11%. But that's still a funny number. Those are all, fairly small. But it wasn't until you started looking at it, well, here's by day, how long did it take for these diseases to show up? And if you look at our conventioneers, people who went to the convention, compared to non-conventioneers, you can see that, during the time of the convention, not that much happened until the last day. And then it spiked for the next few days afterwards before it leveled off and kind of ended. But it wasn't until they started looking at it by hotel, so by age, by hotel, that they started to notice, wow, this is starting to make more sense. And we've seen this one hotel has a larger percentage than any of the others. Maybe there's a connection between the hotel and the disease. Well, 5 months it took after the first cases of Legionnaire's disease occurred. Results of a case control study indicated that spending time in the lobby, so how many people, maybe there's a lobby bar, maybe some people spent time in that lobby bar or just hung out in the lobby waiting for their friends to come down or something along those lines. But other people stayed in the hotel and didn't stay in the lobby. So some of these numbers that we saw were misleading, because it's not that everybody got sick who stayed in this hotel. It was only those people that hung out in the lobby. And that would have taken a lot of time to figure out. And so by December, a CDC laboratorian, I've never seen that word before, successfully located the source bacteria after continuing to test the specimens that were thought to be dead. What it was the air handling equipment in the lobby of that hotel had contaminated water in it, and I don't know if it's a fungus or a bacteria. I think it was a bacteria. Yep, that's source bacteria that was pumped out into the lobby for those people who stayed in the hotel and hung out in the lobby to breathe, and that's what got people sick. So that's one case study. This was a big one because it really, it allowed people to really see this in action. Now, another interesting one, still old, but that's okay, was to look at the number of farm tractor-associated deaths in Georgia. Now, why is this interesting? Well, there's a bunch of deaths that happen, but they're spread out in different ways. So one of the ways that you get killed by a farm tractor is you're driving your tractor in the mud, because that's where you're planting or whatever, and you get stuck. Well, it's a long walk back to the farmhouse to get anybody to come help you. So sometimes people will try and get themselves unstuck by themselves, and that's exceedingly dangerous. You put it in gear and let the wheels spin, you jump off and slide a board underneath it, the tire or something like that. Very, very, very dangerous. And so, that's how you get killed by farm tractors. Another way is when you're hooking up the implements to the back of the tractor, and either these hugely heavy implements roll at you, or the tractor slips backward at you. You're standing between these two big chunks of steel, and it's easy to get smushed. So fatalities associated with farm tractors are an interesting thing to study, and particularly when you look at this time. What can we say by looking at the times when these different incidents occurred? That's fascinating. It's right when people are tired, they're hungry, it's right before lunch, and it's right before dinner. And so it's just fascinating to look at the fatalities associated with farm tractors and think about what these farmers are doing. Well, they're hungry, they want to get home to get some lunch or some dinner. Fascinating stuff. And then the age group. Well, look at it. The younger farmers are less associated with dying, probably because they're more spry. And, walking back to the farmhouse isn't such a big deal for them. But for older farmers, it is. And so they're more likely to get themselves killed by trying to get themselves unstuck or whatever, do stuff by themselves because they don't want to tell anybody that they can't get things done on their own. Interesting stuff. Now let's look real quickly. I posted a bunch of articles in there. Let's see, do we have time? I'll go real fast. I posted a bunch of articles on my courses, and this is information extracted from those articles. So you can read those articles and you'll get way better description of this than I can do real quickly. But this is about healthcare data. So the problem that I'm trying to address in this is that it's hard to do healthcare analytics, not because the topic is so difficult. It's because the data is so distributed and there's so many different players involved. And so, here's our healthcare data ecosystem. One thing to take away from this chart is the number of companies. And the other part is this idea of having originators, intermediaries, and use cases, and all of these different people, different kinds of organizations involved. It's complicated. Now, the other problem that we think about is, where does this data come from? And as we all know, when we go to the doctor, you get your 8 minutes, your 10 minutes to talk to the doctor, and they're frantically typing stuff. Where's that going? Well, there's a whole bunch of players involved in this, and they have their own uses for it. But the main problem with health data is that it's not gathered for analytics. It's gathered to support operational needs, not analytics. The databases are narrow, not so many columns, and normalized. Just like our e-commerce data, where we looked at the one data set that was the operational data, and then we looked at the Google data, which was set up for analytics. And we run into the exact same problem with health data as we do with our e-commerce data. The data that, as it's gathered, is gathered into production databases where we want to gather a lot of information about an individual. But that's not what we want for our analytics. We want a lot of information, but we want it organized in such a way that we can easily run queries against it to look at the impact on lots of people. We don't care about one person. We want to find out about lots of people. And the data's not set up like this. So ways around this, well, enterprise data warehouses. We're used to that. We do that in e-commerce also. Nothing new there. But in the healthcare business, other companies have found this out. So, when you go to your local healthcare provider, you've got labs involved, you've got your insurance company involved, you've got all these different players. and they all have their own data sets and their own production data needs. And so there's been niches cut out for companies like data aggregators that gather all this information from lots of different players and merge it together to create analytics data sets. Then we have patient registries where we have all this information about the individual patients. We have government agencies involved in this stuff. And you know, the U.S. government pays for a lot of our insurance through Medicaid, Medicare, and the Veterans Administration, and lots of different things. And they have their own rules about it. So when we think about health data consumers, we've got a lot of different players in here. We have the payer side, insurance companies generally, the provider of healthcare services, the patient itself, and then the life sciences. Now, this data is kind of word clouded to show that, you know, larger text means more more use of the data, and I'm just thinking about that. You might want to check that in the article. Anyhow, so lots of different healthcare data consumers, and you know, the future of health analytics is incredibly bright, because now we're finally getting to having where everybody's using these electronic health records. EHR used to be called EMR, but now it's called EHR. And what that allows us to do is to do real statistical analyses across lots of different people to look for anomalies in data that's of comparable resource. So where is this going to go? Well, most likely the life sciences are going to be much more involved in using those electronic health records to find out about patient practices and about better ways to improve people's health. Now, what does the future hold for this? Well, huge. And the pandemic, the COVID pandemic, really just got us started in this. And there's a huge amount of growth coming in this field. The future is very bright for people who want to start careers in this field. And I would highly encourage you, if you're so inclined, to start thinking about health data as a field for you. All right, well, gotta go. Take care, everybody. And if you want to chat with me, I'm happy to chat with you. Take care, everybody. Bye-bye.